Now it's my very great pleasure to introduce our next speaker, Dr. Won Woo Choi. Dr. Won Woo Choi is a dermatologist. He's the director of the Wells Dermatology Clinic and Medical Spa. He has a master's degree and a doctoral degree in dermatology from Seoul National University, and he's the author of numerous published articles. Dr. Won Woo Choi will be speaking to us on lip injection and correction of the marionette lines. He'll be giving us an instructional video, and he's going to be showing how he contours the lips using HA filler and PDO threads. Thank you, Dr. Won Woo Choi.
Thank you for nice introducing for me. So, and thank you for giving an opportunity to present today the hyaluronic acid injection for lip and marionette lines in the first global Jetema academic meetings. So my name is Won Choi. I'm working in the Seoul. I'm dermatologist. I focused on the filler, toxin injection, and the PDO thread treatment here. So now, first today I introduce for the hyaluronic acid injection for lip and hyaluronic acid injection combined with the thread treatment for the marionette lines. 슬라이드 넘어가는 게 이건가요? 어느 걸로? 이건가요? 아, 됐네요. Okay, so first slide shows that the superficial anatomy of the lips. As you know, the lips superficial anatomy is comprised of the border and then the volume part. So everyone knows that someone wanted to augment it of their lips. They wanted to volumize the lower lips and upper lips. So, but we consider the border, lips, position, and how much volume they want. So first, we consider over the borders of the vermilion borders and then the skin. And second consideration is the tubercles. The lower lip have the 2 parts of the high tubercles, and upper lip have the 3 parts of the tubercles. And second consideration is the cupid bows. This is the very important part of the lip augmentations because this point shows the more sexy. And this slide shows that the lip anatomy. So first, Professor Han already introduced the anatomies, but I briefly introduce for you. Can see that this slide, you should have a caution in the artery because someone wanted to injection the filler on the lips. We should avoid artery injections. So lip artery positioned below inside the muscle part. So if you inject superficially and from the injection outside, you cannot reach to the artery side. So you should consider for the lip injections first from the superficial skin part and injection superficially. And we consider about the nerve distribution for the lip injections because of the numbness or the anesthetics. So someone wanted to have anesthetic more deeply. We need to the nerve anesthetics. So that time we consider 2 parts of the nerve, median mental lobe, and second is the infra-orbital lobes. So if you want nerve blocks, you should injection these 2 parts. So how to lip nerve blocks? So this slide shows that. So you should injection from the inside mucosal part. It is more effectively make a numbness for the lip side. So, but I think the nerve block or nerve anesthetics is not necessary for the lip injections because you choose lidocaine included filler. It is enough to lip injection without nerve block or nerve anesthetics. So today, my introductions, I use the material for the lip. I choose the Epitic S100 or S300. Two kinds of filler also have the lidocaine included. So for the lip injections, this filler is very good for the lip injection briefly without nerve blocks. And this slide shows that the basic injection 5 points for the lip augmentation fillers. This is just the basic injection point. If you want the filler injection for the lips, basic injection is necessary part. And another point you should consider depending on the every lip shapes and then the border shapes and or the volume size. So upper part 3-point injection point means that the lateral side injection point is for the vermilion augmentations. And then the center point means that augmentation of the upper lip tubercles. And the lower part 2-point means that the augmentation of the lower tubercles. So total 5 injection point is very basic. And then you apply the depending on the every patient lip shapes or volumes. And this video clip shows how to inject the lip using the hyaluronic acid fillers. Okay, you can see these video clips. I use the Epitic S300 fillers, lidocaine included. First, you remove the cosmetics on the lips for the lip injection procedures. And second, I start to the lower tubercle part. During injection, you should check how much volume you inject lower lips because after injection, immediately you cannot define the symmetries or the how much volume in both sides. So just you consider the amount to check how much volume injection. Second injection is another side of lower tubercle augmentations using the same volume of the filler. For these injections, you should slowly injection and superficially injections. The Jetema filler Epitic provide their own special needles. If you need the needles, you injection just a half depth. And third, you injection the upper tubercle part for augmentations. Finally, you should check the lip symmetries. So this is the result. And another case using the Epitic S100, it is more soft fillers. So if you choose these S100 fillers, 2 weeks later, the filler diffuse the whole area of the lips, so it makes a more look natural. And another topic is the hyaluronic acid combined with the PDO thread for the marionette line treatment. The marionette line, the etiology is the first, the loosening the lateral platysma muscles. So actually the marionette line is the depression between lateral platysma muscle and DAO muscles. And second etiology of the marionette line is the atrophy of the fat layer under the marionette line areas, especially the deep fat layer atrophy is the major cause of the marionette lines. So the treatment strategy of the marionette line is to fill up the atrophy fat layer using by the hyaluronic acid filler and lift up the lateral platysma muscle compartment using by the PDO cog thread. So I call that higher thread treatment for the marionette lines. I'm using these materials, Epitic S300 and the PDO cog absorbable thread, the Epiticons. So Jetema Epiticons have some advantage. The Epiticons give a great guarantee the lifting effect even if the thread would be absorbed or the cutting in the middle in the tissues. So this video clip shows how to do higher thread lines. Please show these video clips. So this slide shows that before the treatment of the patient, I use the material two kinds of things, Epiticon and Epitic 300, including lidocaine. Before the treatment, you should check how deep the marionette lines and how the movable the both lateral cheek areas. Some patient, the lateral cheek areas move not enoughly, that PDO thread insertion do not make a satisfactory result. Before the treatment, you should anesthetic injections for the insertion part. And start from the lower part of the chin and insert the PDO thread from the lower part of the chin to the temporal areas. And the reach to the hairlines, you can touch the tip of the PDO thread and pull out of the cannula. And then the massage means that fix the thread inside of the tissues. And another point, insert the PDO thread from the lower part of the chin to the area to the hairlines. You touch it and fix it and pull out of the cannula. And the massage upper part for the fixing the PDO thread inside the tissues. So in my case, I use the thread only 2 or 3 for the marionette line treatment. Cutting the and loosening the insertion part. And these video clips, this part shows that the filler injection for the marionette lines after PDO thread treatment. as you can see, I use the cannula for this procedure because this area, especially a lot of artery running under the side. So please should use the cannula for this procedure for your and patient safeties. So usually, I use the 1 cc of the filler for one part of the marionette lines. But depending on the patient conditions, especially depending on the depth of the marionette line of the patient, sometimes you use 1.5 cc and sometimes you use 2 cc. Okay, finish it. Next slide. So I think you should know the insertion point of the pedio thread. So sometimes I use 3 pedio thread for the marionette line treatment, or sometimes I use just 2 pedio thread. So if you use the 3 pedio thread, insertion point to look like this, and use just a 2 pedio thread, insertion point to look like this. And you can see the under part of the another injection point. The point means that the pillar injection point. So if you have the caution for the injection of the filler in the marionette line, you should deeply injection of the filler for the marionette lines. For these procedures because of a lot of artery running under this area. So the process of hyaluronic acid plus thread treatment is the first epiticon, the pedio thread insertion first, and next you should injection filler. This is the result. Magnified view before and after, 1 month later. The jaw lines is a little bit lift up, and then in the marionette line, the depth is more shallower than before. But the filler injection, sometimes we above DOA muscles. That time, the result is not completely, is not satisfied, because the superficial injection of the filler above the DOA muscles sometimes remain the lines. I think that you should consider side effect of this treatment. The number 1 is the swelling. Usually the 3 or 4 days, and sometimes bruising and sometimes dimpling of the thread insertion part. But 3 of side effects almost spontaneously removed. Thank you for attention.